Success in my practice is really measured by how happy my patients are. And at the end of the day, I always strive to do whatever it takes to keep a patient safe and better. Hi, my name is Dr. ARON. I'm an orthopedic surgeon at Seaview Orthopaedics Medical Associates. I'm a fellowship-trained orthopedic surgeon in diseases and disorders of the foot and ankle. I'm part of Seaview Orthopaedics, which is a multidisciplinary, multi-specialty orthopedic practice. The multiple locations that we have enables patients, no matter where they live, to have easy access to not only myself as a foot and ankle surgeon, but all our surgeons who go to all of the various locations that we have in all 3 counties of Central Jersey.
I had pain in my heel.
For how long?
About 3 months.
3 months, all right. Any activities that you do a lot of?
Running.
Any pain when I do that?
No.
Anything down there?
Not really.
Up there?
Yes.
How much does that hurt? Forgetting that you're a runner, you have some non-insertional Achilles tendonitis, which is a very, very common problem.
So a lot of times people really wonder what a foot and ankle orthopedic surgeon does. A vast majority of the time it's non-operative treatment of common conditions. Heel pain, which is usually plantar fasciitis, is treated by foot and ankle surgeons. Achilles tendonitis is treated by us. One of the most common injuries, which is an ankle sprain, is treated by us, and a vast majority of them can be treated non-operatively with conservative measures. Arthritis of the foot and ankle is treated. Tendinopathy, flat foot, bunions, and hammer toes are all very much in an orthopedic surgeon's wheelhouse. An orthopedic surgeon's day are usually pretty crazy, and no two are ever the same. That said, I try to keep the days as regulated as possible. On surgical days, I start pretty early, and it depends upon how many facilities and what I'm doing that day. At times, the days start very, very early and end very, very late. That being said, you can be going to multiple offices, and I tend to like to have evening hours to accommodate patients who work. It's not about my life and my lifestyle being done early. It's can I help the people who need to be helped. What got me started in orthopedics was athletics. Early in life I started skating and actually became a speed skater. I was actually so good that for many years in between schools, college and high school, I lived up at the Olympic Training Center to train and work with all of those doctors, coaches and athletes, which really made me very, very interested in something in the field of sports medicine. We always looked at orthopedic surgeons as the guys who got us back into action and were the good guys, not the guys keeping us out. And that was very, very rewarding. It made me see that orthopedics has a very, very challenging but rewarding patient population that you can make better, restore function, and give people on some levels their life back. What I find interesting is a lot of my extracurricular hobbies are very much related to or share similarities to what I do professionally. I like cars, I like vintage cars, I show them. I like cycling, I still like skating when I have the opportunity. All of these require remarkable attention to detail and really just a single focus. When you're in a pack of 20 guys on a bike about 2 or 3 inches off of someone's wheel, there's no chance for a lapse of consciousness. You have to be so focused on not only your task, but what your role in that group is, that you have to be just singly focused. When I'm in that room with the patient, that's the only thing that exists. As hectic as the days can be, it's strictly that patient relationship. One of the things that I feel very, very strongly, it's actually a program that I helped start during my fellowship here in Pittsburgh, was on the week of Thanksgiving, we would, all of us, descend on a men's homeless shelter and do free foot screenings, and we had corporate sponsors who would donate socks and shoes, and we'd make sure everyone had a well-fitting pair of shoes, well-fitting socks, and anyone that had pathology that really needed to be addressed was either addressed that night or shortly thereafter. For me, what has both professionally and personally defined an inner happiness is knowing that I am the best that I can be in whatever I set my mind to. For me, what's happiness is when a patient or a patient's mom comes up and goes, "Thank you, you changed my life or my kid's life."